Also this morning, it's a new warning that celebrities may be giving women a false impression that it's just easy to get pregnant over the age of 35 without fertility treatment. A local doctor explains that.
You're watching Good Day Orlando on Fox 35.
Coming up, Hollywood's seeing a bit of a baby boom, especially twins. Many of these moms-to-be, they're over the age of 35.
Well, now experts are warning that celebrities might be giving other women a false impression that it's easy to get pregnant over 35 without fertility treatment. A local doctor explains straight ahead. All right, thank you so much, Kristen. Twins in Hollywood. Is it the new norm? Just last week, Amal and George Clooney announced they're expecting twins. And then just a few days before that, Beyonce announced that she also is expecting twins. And the list of celebrities having twins over the age of 35, Mariah Carey, Sarah Jessica Parker, Rebecca Romaine, Jennifer Lopez, the list goes on. And then Janet Jackson just had a baby and she's 50. Well, experts warn celebrities are giving women the wrong impression that it's easy to get pregnant over the age of 35, maybe without fertility treatments, because they don't really talk about it. Joining us this morning to talk more about it, he is talking, Dr. Mark Trolice with the IVF Center. Great to see you. Thanks for being here this morning.
My pleasure, Amy.
All right, so when you hear these stories, are you like, I have a feeling these women are using fertility treatments?
Well, certainly when they're older. When they get into the 40s and above, you have to be thinking about egg donation, actually.
Right.
But, you know, on a monthly basis, not necessarily so easy to conceive. Let me give you some numbers. At age 30 or less, 20% on a monthly basis will conceive. 35, 10%. And then at 40, it goes down to 5%. So there's a continued decline in fertility as a woman gets older. What about twins? Interestingly, as a woman gets older, it increases a little bit.
Really?
The chance of having twins will increase.
That?
Not too sure. Not too sure. I don't know if biologically, as a woman gets older, the chance of having a child is less, so maybe opportunity for twins. Not sure.
Okay.
But the interesting thing is that they did a study over 30 years that ended in 2009. The chance of having twins went from about 1 in 50 to about 1 in 30. So we're seeing overall about a 50% increased risk of twins. Age 35 to 39, 100% increase in twins. Age 40 and above, 200%. Wow. What does it due to? 1/3 is as a woman gets older, but in 2/3 of the cases, in vitro fertilization, things that we do.
Okay, and I think when we talk about sort of giving false hope to the average person, obviously one thing celebrities have that most people don't have is a lot of money, because it is expensive to go through this process, is it not?
Yes, absolutely. Particularly in vitro fertilization, it is costly. And, you know, patients are in a little bit of a bind because insurance doesn't pay, and they come to see me and they want 2 instant family.
Right.
They're putting a lot of money into this, and they say, well, only one embryo to transfer. That's the right thing to do for women, certainly less than 37, to transfer 1 embryo. Beyonce, 35. So transferring 1 embryo is the right thing to do to reduce the risk of complications. What are the complications? The chance of high blood pressure and diabetes in pregnancies doubles.
Oh, wow.
The chance of a baby delivering early and low birth weight triples. So the goal is not really twins as much as all of our fertility patients want to have twins. The goal is a single healthy baby. But when they're paying out of pocket, insurance doesn't pay, they don't know if they could do this again, they often ask for 2 embryos.
It is fascinating, and it's certainly fascinating to watch what Hollywood is up to. Dr. Trolice, how can our viewers find you?
Well, the IVFcenter.com, or you can see me at Twitter at Dr. Mark Trolice.
Always great to have you on. Thanks, Doc, for being with us this morning. 8:52. Bob, we're going to send it over to you.